Well, hey, Dr. Stites, thank you for taking a little bit of time with community this week to let us know. You and I had hoped to be together, but things are just so full for you right now. And this is a great way for us to make sure to have a little bit of time together to answer some questions and to have conversations. So really, thank you for everything.
Yeah, you bet. I'm happy to be here. I'm sorry we're not together. But yeah, things are a little crazy these days.
Yeah. So let's start with a really simple, complex question, which is, we've been living in a pandemic now for 18 months, and now we are confronting the Delta variant together. So what makes Delta different than where we were before?
Yeah, you bet. So I think Delta is actually making us more vulnerable than we were before. And here's why. First of all, the Delta variant is more transmissible, and that's the scariest part. Back at the beginning of the pandemic, when we were talking about SARS-CoV-2 and the original strain, which many people will call the wild type, or even the Alpha variant, which is the one that was originally described in England, their transmissibility was all about the same. And it took about 10 to 12 minutes of close contact within 6 feet of somebody really indoors to have enough transmission of the virus that you could get sick and from another person. And so that was a little higher than, that could occur a little faster than influenza, but a lot slower than, say, chicken pox or measles or smallpox and other, terrible scourges of mankind, if you will. The problem with the Delta variant is that it spreads so much more rapidly. It's likely that one person with the original strain would infect 2 to 4 people. Now one person is probably infecting 5 to 10 people. And the transmission time is no longer 10 minutes. It's probably more in the range of 4 minutes, maybe as short as 2 minutes. So the ability of one infected person to infect other people is much shorter, which puts a lot of emphasis on infection control inside. Outside, we think you're still pretty relatively protected, especially if you're more than 3 feet and preferably 6 feet apart, because the air currents outside disperse the virus so much. When it disperses what we like to refer to as the breath cloud. When you're inside, air movement is not the same. You don't have all those funny wind currents and things like that, and wind bouncing off of trees, the ground, and the sun doing funny things. All that shifted. And so as a result, your breath cloud tends to hang around you. You ever saw from our morning media update, you saw the old freezer videos, we would breathe out, you can see where the breath cloud sits. And so if you're next to someone for a short period of time, they're probably going to get enough of the virus to get sick. And that's what makes it so much more troubling. The second thing that makes it so troubling is we just don't have enough people vaccinated. And I know a lot of folks have concerns about vaccination. And you know what, it's a new drug. I prescribe new drugs to people so many times throughout my career. And I'll tell you, I'm a little conservative. I don't go right to the new drug right away I like to see how I like to read all the data about it. And I like to have patients take it for a while and see how other people's patients do before I put my patients on it. This is a different time, and this is a different place. This is not usual. And it's different because the pandemic can affect so many people so fast, and so many people can be vulnerable around it. And so the Delta variant is so dangerous that the only real protection you can offer yourself is 1, to mask, 2, to vaccinate, and 3, to distance. Now, the most important thing to do is get vaccinated. But in the short run, if you're not vaccinated, you've got to get a mask on. And even if you're vaccinated, you ought to have a mask on. And here's why. Because it's so transmissible, when you're you're in 3 to 6 feet of someone, it doesn't take very long. You have to protect yourself by putting a mask on, and the other person needs to have a mask on. We know that even those people, and this is very different with the Delta variant than the first two, we know the original one and the Alpha one or the other similar strains. The Delta variant is almost a different virus. It's not really, but it feels different in its infection dynamics. So that even a person who's been fully vaccinated can acquire the Delta variant and spread it to someone else. That's different than the original strain. And that's one of the reasons it's so dangerous. It makes all of us a potential vector. Even if those of us who have been vaccinated are much less likely to get sick. And 90% of our admissions are unvaccinated people. You can still spread it to someone else. It may not be quite as easy as somebody who hasn't been vaccinated, still too easy. And that's what makes the Delta variant really dangerous. It takes much less time to transmit. And both vaccinated and unvaccinated people can transmit it. What is different about it is that the unvaccinated people are the ones, at least as I said, 90% of people in our hospital today did not have a vaccine. Only 10% have been fully vaccinated, which means that it's much riskier to get really sick or to die, because the odds of death are 95 or 98% of people who are dying are unvaccinated. Only a very small percentage are fully vaccinated. And of those small percentages, almost all of them have severe underlying disease. But actually, all of them have severe underlying disease. So if you've been vaccinated, you will be safe from severe hospitalization and death, even with the Delta variant, unless you are so darn sick that the vaccination may not have taken. But even if vaccinated, you can still spread it. And for your unvaccinated, your likelihood of picking it up is much higher. And it looks like you're going to have a higher chance of getting really sick.
Mm-hmm.
So there has never been a more important moment in this pandemic to take all of it as seriously as you can and to follow all the rules of infection control, which travel with you and keep you safe wherever you go. So wear a mask, wash your hands, keep your distance, get vaccinated. Sorry, my long-winded explanation. There you go.
I'm grateful for your wisdom and your expertise, because I think so much of what's happening, it's about informing ourselves and knowing what's going on from people who know the science. So you have been such a great shepherd for that for us in the journey through this. As far as the church goes, we're continuing with in-person worship right now. How concerned should we be when we are together in worship? And what can we do while we're here to keep one another as safe as possible?
Yeah, you bet. Great question, Ryan. Thank you. So I think the first thing we do is encourage everybody to be vaccinated, because that always helps, as we just talked about. The second thing to do is you got to stay masked. I think it's okay to sing with a mask on quietly, but because in our church we are doing the third rule, which is to stay distanced. So within your pod, Sandy and I are married 35 years. We're going to sit together. That makes sense. But we're trying to stay away from all the other people's pods. And then when we congregate sometimes after church in the narthex, try and keep your distance. Have a conversation, fine, but keep your distance from each other.
Or go outside
go outside, which is even better. That's exactly
Mm-hmm.
right. Yep.
Mm-hmm. Yeah.
So I think the key is what we're doing. And I think, to be fair, we're going to have to watch very carefully what happens around any possible, if we see some signs of potential members getting infected in the church, I think we'll have to think differently. I don't know that now. You and I have not had that conversation. I think we're probably okay. And trust me, I watch this every single moment, every single day, looking to see what the story is for inside transmission of disease, either vaccinated or unvaccinated, with your mask on. So far, I think we're okay with masks on. But again, we're very blessed in our church. Well, we're blessed for a lot of reasons, but one of it is we can stay distanced from each other and still be in worship together.
So one of the primary concerns I've received from church members has been the concern for our littles, as well as our older population who's more vulnerable health-wise. How concerned should we be for our unvaccinated littles? And how, of course, we'll take the steps for prevention and protection that we've already talked about, but what else can we do to support that work and to care for those littles?
Boy, that's a really great question. Number one, wear a mask. Number two, wear a mask. And number three, wear a mask. And I think we can keep our littles masked. Now, I know under 2, it gets really hard. But I think 2 and above, pretty good data out there. We can get folks to keep a mask on. And I watch our children during children's worship. They do a great job of keeping their masks on down there in the sanctuary. So I think wearing a mask keeps people a lot safer. So far, it appears that children with the Delta virus, while having a higher chance of getting sick than they did with the original strain, it's not chicken pie. It's not as bad as it could be. So I think we're still okay with masking and distancing as much as possible for our littles. I think that's something we're going to have to watch very, very, very carefully. And we don't want to see our kids get sick. But I think the church is a less likely spot of getting sick than a playground, than a classroom, or places where there are a lot of kids coming closely together. And so if we can maintain distancing, keep our masks on, I'm going to say we're okay right now, but I think it's going to bear watching. For our older members of our congregation, I think you have to take stock of what your health is like. If you have a lot of underlying problems, or you're at all concerned that the vaccine didn't take, then I think you have to ask yourself if worship from home may make more sense, even if you're masked, because the potential of getting sick and hospitalized is a real threat. And so I think if you're otherwise pretty healthy, even if when you're over 65, you're pretty healthy and you have no reason to believe the vaccine should take, then both Moderna and Pfizer data look pretty darn good in the elderly, and the nursing home data is staying low. And that's a very vulnerable elderly population. And there are only about half the workers in nursing homes are vaccinated. So they're still getting exposed. But so far, we're not seeing a big uptick coming out of nursing homes in the hospitals, telling me the vaccine is still working inside nursing homes. So I think it's going to still work inside our church community.
So
take stock of yourself, and if you're all nervous, go to online.
All of that's really helpful, especially as parents get ready to move back to school and try to figure out the balance in the fall. So thank you. And I know that many of our older members have wondered that too. So I'm really grateful for that answer. So the last question I want to ask you is not like any of the others that I've asked you. And it's, we're a church, and we've watched as a congregation, as you and as many of our members who are nurses and physical therapists and so many others who work in healthcare settings, we've watched you over these last 18 months ride the waves of all of this. And there have been so much, there's been so much on social media really in the last week and in the news about how exhausted you all are, and about ways in which this is so much worse for healthcare professionals than it's been so far. So my question for you is, how can we be praying for you right now?
Well, that's really kind. I'll tell you, the best thing you can do for me is to pray for all the people in healthcare working so hard. I know everybody's tired of the pandemic, but man, our healthcare workers at the front line, they're exhausted. We had a meeting today talking about what we're going to do for our frontline folks, because you can see it in their eyes, you can hear it in their voice, you see it nationally, not just locally, because things are tough right now. They're really tough, and we're getting so many patients back in the hospital who are sick with non-COVID things. Every hospital in Kansas City is really full, but they're full of non-COVID and COVID. So people are stretched, and so I think the prayers, Ryan, for resiliency. At what point is resiliency lost? And that's a very individual answer. And I think fatigue and sleep and mental stamina, so many things affect that. But I pray both, I would ask on a selfish level for myself, but really for all the healthcare workers that we have in our community and throughout our community, prayers for resiliency and strength, and to try to find some level of peace to help you navigate both of those things. And maybe a little bit of sleep. I think sleep is always good.
Yeah. Thank you for this time.
Of course.
Thank you.
And thank you,
being
Ryan,
on my...
for all that you've done. I mean, you've done a great job leading us, and I just can't tell you how much I and all of us I know appreciate you and the team, Community Christian.
I've been amazed to see you on my TV every morning for the last year.
I'm sorry you have to do that.
it's you're better than Kathy Lee and Hoda. It's great.
I don't know. Most people, I'm not really a looker, so there's probably some other choices out there. But yeah.
Well, thank you, Stephen.
We'll stay on
message. Thank you for everything you're doing, and you are in our prayers.
Thank you.